Hey guys, gals, and non-binary pals, I'm your host Hannah, and this is Under the Scrubs. We are here on this hopefully beautiful Tuesday, drop day for our new episode, and we are talking about Dr. James Marion Sims, Big Daddy of Modern Gynecology, but did a lot of abhorrent stuff to get himself there. This feels weird considering my last name is Sims, but my dad was adopted, so I'm claiming zero relation to James. I'm always curious how men decide to go into gynecology. Like, you don't have the plumbing, so how can I relate to you as a patient, right? We can't bond over hormones or period cramps or birthing babies. You don't even go here, but somehow you're the expert. Is there a male field that is equivalent to this? Like, can I be an expert in dicks? I'd like to think professionally I am. I have been called the penis charmer, but that's only because I can get those catheters on an innie, if you know what I mean. I've also seen a lot in my line of work, so maybe I'll try and practice a vasectomy or two, call myself an expert, make it a streamlined process like Walter Freeman. All right, little episode 3 reference. And I will call it the family finisher or no mo flow. Oh, no, I'm going to call it Done Daddy. I don't know. I'll work on it. But if anyone can tell me how to create an LLC so I can start doing that and maybe offer up your vast deference to practice, I'd really appreciate that. For this week's timeout, I figured we could discuss the ever-growing concern of cults. Listen, I was starting one at one point, okay? Cycle bar. I was getting to other people on the unit that I was traveling on. I got them to join me in doing spin classes. And I did end up getting my own Peloton so I could continue to ride at home for cheaper. So I guess I just moved my cult into my home. I'm also currently on the sourdough cult, but I'm self-aware and I'm trying not to get too crazy about it. All right, but let's talk about the elephant in the room. Matcha. You cannot tell me that tastes good, okay? It tastes like dirty swamp grass water. I'm assuming that's what Shrek's swamp tastes like. Driving electric cars, especially a Tesla. Oh my God. I get it. You can do so much with your car and your phone, and you don't have to spend so much in maintenance, but is it really that worth it? Now I got to add another thing that I got to plug in every night to my nightly routine. Okay, my skincare and hair care already take up so much time, but now, oops, I got to plug in my car real quick. BRB. Also, I think Teslas are ugly, and I think they all look the same, and Elon Musk modeled the Cybertruck after his body type because baby boy is built like a baked bean. Okay, and I'm sorry in advance for this one. Taylor Swift, okay? She is our current Justin Bieber. Remember back in the day when there was girls crying on TV because they were thought they were going to get the chance to meet him or see him? Okay, Taylor Swift is that now. And don't get me wrong, I used to listen to her, but we're talking her first album or two. I had to download the songs off of LimeWire or FrostWire and burn them onto a CD. Anyone who owns a Ninja appliance, we get it. You paid more than you really should have for a kitchen appliance. Individuals who are obsessed with gut health, and I'm talking the people who take it to the extreme. If you try and make me eat a spoonful of something called sea moss or some other weird-ass substance, I'm calling my mom, and you don't want the smoke from Carol. And at times I feel like this kind of goes hand in hand with people who opt for gluten-free because they think it's a health choice. Now, if you're truly concerned, obviously, go get tested. See if you actually have an intolerance or celiacs. But until then, eat the bread, Deborah, okay? Back in the day, people ate gluten, no issue. I'm pretty sure I'm lactose intolerant, but I just keep eating it in hopes that I evolve with time, okay? People who drive Jeeps, and to follow that up, Subarus. If your whole personality revolves around what you drive, it's time to branch out, explore the world, touch grass. Speaking of touching grass and getting back into reality, we are going to dive into our episode today. Resources for this episode are PubMed, Journal of the National Medical Association, PBS American Experience, Sage Journals, the College of Physicians of Philadelphia, and NPR. So Big Papa of Modern Gynecology, James Marion Sims, he had a massive influence on modern medical practice even to today. And this guy was born in 1813, so a long-ass time ago. He was the first of 8 children, and he had a pretty unremarkable childhood. He was encouraged by his father to become a lawyer or a minister. James said, nah, I want to be a doctor. And at least he was realistic. Okay, we love a self-aware king. He said he was, at best, a mediocre student who was never remarkable for anything except good behavior. He enrolled in medical school in 1833 at the previous Charleston Medical School. It's now known as the Medical University of South Carolina, where he had studied for a year before transferring to Jefferson Medical College in Philadelphia. Afterwards, he would return home to Lancaster County, Alabama, to begin his own practice. And during this time, though, he found out that he just was not down with the sickness. In 1840, there was a shit ton of cases of malaria, so James packed up his office and sought out a healthier climate in Montgomery, Alabama. So we are in Alabama during a time where slavery is very present and a good portion of the population. It is important to note that in 1820, in response to the U.S. ban on the importation of new slaves from Africa, majority of the slaveholders started to improve the living conditions of their slaves to cut down on escape attempts and to keep them healthy. So an ill slave meant a lack of, their productivity and possible death. So these slave owners weren't actually acting out of the kindness of their heart. And don't get me wrong, there was very few, but most of them were just acting out of economic interest. Practicing as a physician in the South was very dependent on the economy of slavery and the area's slave-traded system. So there's a large patient population to serve, and James jumps on it. He rapidly gains notoriety for being a skillful general surgeon, and he builds a private 8-bed hospital in the back of his home. That doesn't sound sketchy at all. At this time, James is rolling in the high life, okay? He's making bank off the backs of enslaved individuals from the local plantations, and he really wasn't showing any signs of interest in gynecology. He was actually quoted at the time saying, "If there was anything I hated, it was investigating the organs of the female pelvis." How ironic. So in order to look into the vagina, we now know you'll need a speculum. In 1845, this was fashioned using a bent spoon. A patient had been thrown off her horse, and she landed on her pelvis, and she developed uterine retroversion. So this is like a tilting or a tipping backwards of the uterus. James was attending to this patient, and he had the epiphany that he could create a custom tool that would allow him to see better in the vaginal canal, and so he used 2 bent spoons. Very innovative. He looked up there and said, "Oh my God, no one's ever looked up here before." He actually wrote in an unfinished memoir, "I felt I was on the eve of one of the greatest discoveries of the day." He found his newfound speculum to operate on women that were suffering from vesicovaginal fistulas. We're going to call them VVF. So VVFs were a real issue back then. These were abnormal connections between the bladder and the vaginal canal, or the rectum and the vaginal canal. These connections would often develop during difficult births when the pressure of laboring would damage the tissue between the vagina and bladder or rectum. Think of it like a crush injury to the soft tissues of the pelvis from trying to deliver babies that can't fit through the birth canal. So you're pinching off that tissue and the blood flow to it. So these poor women were basically always leaking urine or feces through the vagina. And so because of it, it basically was a chronic malodorous condition. There was even loss of vaginal function due to the extensive scarring of the birth canal, as well as pelvic and urinary tract infections. One of the few options for women was you could sit on a chair or a stool with a hole through it, and you basically just dripped into some kind of receptacle underneath. It was considered such a shameful and disgusting condition to have. A plastic surgeon back in the day wrote that, not only does it affect the women, but of course, there must be concern for her husband, as she is now the object of bodily revulsion to him. Okay, if I push your big-headed baby out au naturel and I don't die from it, the lack of medical care because it's 1800s, you better put some respect on my name. The lasting effects of this fistula tore down, self-esteem of women who developed it, right? They damaged their body image, led to depression, and even led to suicide in some of these women. So enter James and his double bent spoon speculum. In order to look up the vagina properly, he would have the patient either get on all fours and look up there, or, as we know, the Sims position. So you lay on your left side, you got your left knee slightly bent, and then you bring your right knee pretty much up to your chest. And he would use this position for vaginal and or rectal exams, and it was also considered a traditional method for carrying out childbirth. James made this miraculous transition from general surgeon to gynecology with that patient that was tossed off the horse. So when he had placed her into the Sims position, he used a speculum to look up there, and he relocated her displaced uterus, which in return caused a change in air pressure, and the relief for the patient was immediate. He described the moment, "I cannot, nor is it needful for me to describe my emotions when the air rushed in and dilated the vagina to its great capacity, whereby its whole surface was seen at one view for the first time by any mortal man." That's what I mean when he said, "Oh my God, I'm seeing something that no one else has seen." So thinking about this, and just if you see a picture of him, I'll post it on the Instagram. You know, just picture that with his little like double bent spoon. Ugh, gives me the biggest ick. So he takes his fascination, his little spoons, and he decides he's going to start treating these fistulas, or at least trying to. So between 1845 and 1849, he starts his experiments, and he experimented on a total of 12 enslaved women that had been, quote unquote, loaned out to him by their enslavers. According to James's journal, during those 4 years, he had subjected these women to numerous experimental surgeries, and they really had minimal time for healing between them. The use of anesthesia was still in its infancy stage when James began his quest, and as we all know in the medical community, change is not often always welcomed with open arms. I worked a contract once where a hospital that they started stocking a different insulin needle, and you'd think that's not a big deal. There was a borderline mutiny on the unit. Okay, we don't like change. James never administered anesthesia to these poor women while he operated on them. In his surgical notes, he reported that the pain women experienced was not great enough to justify the trouble or the risk, which sounds like bullshit to me, okay? Even these days, you don't get shit for an IUD, and yeah, it's a quick procedure. I almost passed out during mine, okay? I started holding my breath because I'm thinking, I pass out, free anesthesia. They basically spit on your cervix, pinch it, pull it, shove that IUD up there, okay? You're trying to tell me performing a surgery on a fully awake woman, hey, you don't think their pain's too bad? Be so for real, James. And this fixation of the fistula wasn't for the good of women, by the way. It was largely fueled by the fact that enslaved women would drop in quote-unquote value if they were unable to have children, and if they struggled, they would struggle working, because they were constantly leaking urine, feces, or having skin infections, or having issues. So therefore, they're not working as much. Therefore, they're not as valuable, which is nauseating. There are 3 women who were actually documented and that had records that had survived that were James's victims. And I say victims because that's what they were, right? They were tortured. They had the VVF and they were wanting repair. James operated on one of them numerous times before he declared her healed. The part where he said pain wasn't that bad, he had documented in his surgical notes that one of the women's pain was visibly immense during one of the procedures. So it's not great. He really contradicts himself, and I'll cover that in a minute. But in reality, we only have James's side of this history, right? James reported in his journals that women clamored for the surgery and were willing to submit repeatedly for the procedures. And yeah, there probably were women that wanted this fixed, okay? If you didn't, you were considered less than, and you were often treated like a stinky pariah and exiled from your social group. But were these women really given the chance to say no? As they were enslaved women, they don't really have rights. Then did they have the opportunity to say, oh, no, thank you, I'm still recovering from the first dozen procedures that you tried? These women were operated on butt-ass naked in vulnerable positions and often with multiple other physicians watching. And this absolutely disgusts me, but it is during this time that it was believed that African American patients did not feel as much pain as the white patients did. So that was one of the reasons why he didn't want to use anesthesia. and then he wanted to lessen blood loss, so he would do these procedures quickly, and that was his other reason for not wanting to use anesthesia. And I think it's important to talk about the women who helped James with this infamy in gynecology, because they're part of the reason, right, that he was able to be successful and be so influential in the medical community. Anarcha was 17 years old in 1845, and she had delivered her first baby. For 3 days, she struggled before medical help arrived. Anarcha suffered from rickets, which had caused malformation in her pelvis. Rickets was very common, as well as scurvy, amongst the enslaved population, as they suffered from nutritional deficiency. So with this malformed pelvis, obstructed labor was a common result from it. With the discontinuation of the transatlantic slave trade in 1808, it was important to the slave owners that they had childbearing women to continue having work on their plantations. So when medical help finally arrived for Anarcha, she received help from the local doctor. This is James Marion Sims. Keep in mind, James is still considered a general doctor at this point. He delivered Anarcha's baby using forceps. The baby's head was so impacted in her pelvis that the labor pains had almost completely stopped. So not only is it scary to be using forceps, but especially by a doctor who rarely uses them to begin with because he didn't deliver babies, forceps increase the risk of hemorrhaging and injury to the baby. By the grace of God, Anarcha survived the birth, but James did not record the fate of the baby. With the complications Anarcha faced during her delivery, she did develop VVF, and this was the first case James had seen and recorded her condition as hopelessly incurable. Betsy was a 17 or 18-year-old enslaved woman, and she was already admitted to James's backyard hospital when that woman that had been thrown by the horse. So James, when he had relocated the uterus, he stopped by to see Betsy. Betsy was suffering from VVF after a difficult delivery about a month prior. And Lucy was an 18-year-old enslaved woman that was brought in by the man who had enslaved her, and he was requesting an examination for her. Lucy had given birth about a month prior, and since she, quote-unquote, had not been able to hold any water. So these three women had been examined by James, and they all received the same answer, that there's nothing that they can do, their condition's going to be chronic. But once James had his new speculum, he asked the man who had enslaved Lucy to examine her again. James writes that Lucy willingly consented to this exam. A few months later, and some slight adjustments to the speculum, James wrote to the men who enslaved Betsy and Anarcha and requested to examine them again. James made an agreement with these men that James would care for the women at his own expense as long as the men continued to pay the property taxes, and that James wouldn't perform any operation which would endanger the women's lives. James goes on to find more women who would be, essentially loaned out to him so he could start these experiments. So none of the other 9 women had their names recorded by James, so rendering them voiceless and, denying them any kind of identity. James first operated on Lucy in December of 1845. He wrote about Lucy, that poor girl on her knees bore the operation with great heroism and bravery. Lucy's operation appeared to have gone well, but resulted in blood poisoning, which I'm assuming is sepsis, due to an improvised and ineffective system devised to draw urine away from the fistula. After Lucy was deemed to have recovered, James noted that the fistula was different. The opening had decreased significantly, but it was not cured. He modified his technique and then operated on Betsy. Again, he seemed to make it better, but not cure it. He modified and then operated on Anarcha, but her operation appeared to not have made any difference. So for the next 4 years, that's his pattern for all the women involved, right? Operate on this one, see how it does, modify, operate on the next one. Finally, after 29 failed operations with Anarcha, the 30th would be the one that would be deemed to cure the women, but we will never know. He didn't record any of that. We can only assume that he did use that operation to cure the other women, right? So that's the dark side of this history, right? James made his living off of exploiting a group of people who were vulnerable and unable to really consent for themselves. A group of people that were reduced to numbers and efficacy instead of who they were as a person. And while he is considered the father of gynecology, Why are the women who he operated on not considered the mothers of it? I mean, for Pete's sake, we have 3 names out of how many that he's operated on. And look, I'm going to level with you. Yes, James took like a shit ton of notes, right? But he constantly contradicted himself. So when he did the VVF surgeries on women of color, he did not use anesthesia. He wrote in one journal that he didn't do anesthesia on any of them, regardless of their skin color. But then he writes in an unfinished memoir that he did do anesthesia for white women at the women's hospital. He claims that the pain isn't bad, and so that's why he doesn't use anesthesia. But then in another journal, writes how bad the pain is. One of the entries said that Lucy was in such agony, he thought she was going to die. This is what we would say in the hospital is a unreliable historian. But I feel like these are really important things to be upfront about because these discrepancies really play into like the public opinion. Was he racist or just a man who thought women didn't need anesthesia? In 1855, James goes on to relocate to New York, and he opened the New York Women's Hospital, which was the first of its kind as a specialized hospital in the world dedicated exclusively to women's health and the treatment of women's diseases. It became the leading center for gynecological research, training, and care. Under James's direction, the hospital advanced the study and treatment of many different gynecological conditions. James contributed to fertility treatment through techniques like artificial insemination and the postcolloidal test, which evaluates sperm presence and their movement after sex. During a time where the belief was that cancer was contagious, James actually argued for the admission of cancer patients to the women's hospital, which really helped advance the care and understanding of the disease. James promoted the use of laparotomies to drain wounds, mend internal damage, and stop bleeding from bullet wounds in the abdomen. When President James Garfield was the target of an assassination attempt, it was actually James's knowledge that was requested. In addition to the VVF correction, James also created methods for treating uterine prolapse and cervical carcinoma. In 1878, James performed surgery to drain a distended gallbladder and remove its stones. He did believe he was the first to perform such an operation, but a similar case had already been reported in 1867 in Indianapolis. His findings were still significant enough and added to the body of surgical knowledge. James goes on to contribute further into the field, different, medical instruments along with like the speculum, sigmoid catheter, uterine curette, uterine sound, vaginal retractor, uterine scissors, and rectal speculum. With James' controversial ways of exploiting enslaved individuals came to light in the present day, people really took notice. In 2006, the University of Alabama, Birmingham removed a painting of James. It had called him one of the medical giants of Alabama. The same year, the Medical University of South Carolina renamed an endowed chairmanship that was initially named for James. A statue that was made of him in 1890 was moved to across the street from the New York Academy of Medicine in 1934. It was in Central Park. And there it stood until April of 2018, when a New York mayoral commission examining controversial monuments said that statue's gotta go. The statue was moved to a cemetery in Brooklyn where James is actually buried. There has been calls for renaming the medical instruments that James invented, even calling for the speculum to be renamed the Lucy speculum. We can't erase the progression that James contributed to in the medical field, but we can try to rectify and add those who were part of the success and make their names known and make their identities known. I'd say learn from the messed up shit James did, right? But hopefully I don't have to tell people to not be a racist dickweed. Our history in medicine is not an immunization against the present, right? We hold our medical professionals to a higher standard of ethical and beneficent behavior. While the dark history of our advances still casts a shadow, it's up to us as providers and caregivers to step out of that shadow and make positive outcomes for our patients, no matter their gender, race, or identity, because everyone deserves that. And that, my besties, is our conclusion for James Marion Sims. I figured we could visit a different dark side to our medical community next week, so we're going to talk about Joseph Michael Swango, the doctor who poisoned 60 people, and that's both patients and colleagues, so he definitely would not be invited to the unit potluck, that is for sure. And I will see you guys next Tuesday. Okay, love you, bye!